So hello, everyone. Thank you again for joining us. As Jose mentioned, as you're coming on, if you could please mute yourself, and towards midway through the presentation, we'll go ahead and have a time for Q&A, and that's when you can unmute and ask questions. But we'll go ahead and get started. This is Day in the Life Healthcare Edition. So we surveyed you all last semester, and there was a lot of interest in careers in healthcare. So that's why we bring this presentation to you today. My name is Mariana Hernandez. I'm the Assistant Program Manager of Workforce Development at LAEDC, and I'm joined by my colleague who can go ahead and introduce himself.
Yeah, welcome everyone. My name is Jose Pelayo. I am the Program Manager of Workforce Development with LAEDC.
Thank you, Jose. And before we hear from the speakers, Jose will speak to a few points about healthcare in the LA region.
Yeah, no, thank you, Mariana. So just wanted to give you guys some quick data regarding healthcare industry. One of the biggest things as you're considering healthcare is kind of understanding if there will be job openings in the future or if there's currently job openings. As you can see, healthcare is one of the industries that currently has many openings in different occupations and will continue to have opening based on data through 2025. So one of the highest growing industries that you should look into joining. So as you can see, registered nurses, medical assistants are currently one of the biggest needs in the industry. Next slide. And then another big question, of course, is how much would I be making if I get into this industry, and what different occupations and different places I can work with in that will pay the amount. And as I was mentioning, if you can please mute yourself in the meantime while there is a Q&A portion. As you can see here, the annual pay, and annual is usually what you refer to as yearly pay, what you will make in a year. As you can see, what you'll be making in different places. For example, hospital, the annual income is $89,000. For ambulatory health services, it's $70,000, as you can see there. So it's a great opportunity, great industry to get into. And again, that's the median, that's the average. That means you can make more or you can make less, but then on average, this is where individuals will be making, which is a good amount of money. Next slide. And then I wanted to bring this up because one of the biggest things that you should be accounting for is education, right? What do you need to go into these fields? As you can see here, use medical assistant as an example. Most of the medical assistants usually have some college, 52% usually have some college or an associate. So again, medical assistants usually require some college or associates, and it's usually dominated by females. So if there are males that want to go into the field, that's a good thing because the field is in need of a lot of males throughout the different occupations. So again, you can see the age again, it is dominated by 25 to 39, which is a good, age range. But just we will be sharing this presentation as well, so you can take a closer look at the different occupations and what is usually required in regards to education and usually what the age group is on that field. So Mariana, I'll pass it back on to you.
Thank you, Jose.
There's one more slide, so sorry, I didn't know about this slide. So again, what you want to consider as well, which companies which are hiring in the industry, which are the major companies that are hiring. As you can see, here are the major companies within the LA region. All the information that we presented is data that we captured with our Institute of Applied Economics, with LADC, that is current and accurate to Los Angeles County. So these are some of the major employers that are currently hiring with over, I want to say maybe 5,000 plus openings, definitely higher than that. So in case you are looking to move forward, these are some of the companies that you want to keep in mind.
Thank you, Jose. And with that, we'll go ahead and introduce our speakers of today. So we have first up Donna Costales, which is the Nurse Manager of Clinical Operations Support at Cedars-Sinai, which in the previous slide you just saw, Cedars-Sinai is one of the top employers in the LA region for healthcare careers. So I'll go ahead and pass it over to you, Donna, to introduce a bit about your background just for a few minutes, and then before I introduce the next person.
Hey, Don, I think you are on mute.
Sorry, Jose. All right. My name is Donna
You have to
Costales.
show your,
The mug. I'll get it later. You're on mute too, Gwen. Hi, my name is Donna Costales. I'm the nurse manager of clinical operations support here at Cedars-Sinai. I've worked at Cedars-Sinai for 33 years. I came at Cedars-Sinai right when I graduated from nursing school, and here I am 33 years. And I'll tell you more about how my experience is as being a nurse. Thank you.
Thank you so much, Donna. And up next, we have Diana Barrientos, medical assistant at Cedars-Sinai.
Good afternoon, class. Good afternoon, everyone. I am Diana. I've been a medical assistant in the field for 35 years, but here at Cedars for 22 years and loving it.
Thank you so much, Diana, for participating today.
Thank you.
Next, we have Quinn Hurlbert, Director of Nursing and Clinical Operations at Cedars-Sinai.
hi, everyone. I'm Quinn Hurlbert. I'm the Director of Nursing and Clinical Operations, and I've been a nurse for 23 years, mostly ambulatory. And I just want to say what Jose just showed a minute ago in regards to the lopsided gender field. Yeah, it's no longer a female profession, so you're really wanted if you want to go into a profession and you're a male. We really want to have you as part of the team, and I am talking for all of healthcare, not just for Cedars-Sinai.
Thank you, Quinn. And now we have Nancy Trujillo, a medical assistant at Cedars-Sinai. Nancy, you're welcome to unmute. I know I saw you earlier. If she might be having technical difficulties, we can come back and have her say a few words. But in the meantime, we'll go ahead and get started with our questions. So I'll go ahead and stop sharing the screen so we can all see each other. But the students who have any questions, you're welcome to enter them in the chat or unmute and ask away. So anyone who is ready or has a question for either of the speakers today, please go ahead and ask away.
Yeah, if I can add, Mariana, students, it's a great opportunity to engage with these great, amazing speakers and kind of learn more about what it takes to be on that field, learn how they got there. So if you are comfortable, I would advise that you unmute and practice those communication skills and ask away. There is no wrong questions, but again, it's an opportunity to engage and learn more about the industry. If you are a little bit shy, as Mariana mentioned, that's okay. I remember I was shy myself. You can put that in the chat and we can read that. So feel free. Again, if you have a question, you can raise your hand or you can unmute and ask away. And if you guys don't have any questions in the meantime, what we'll do is Mariana will start engaging on some of the questions that we feel you guys would want to be interested in learning more about.
Yes, thank you, Jose. So, and this is an open question to any of the panelists, but if anyone would like to share more about why you chose healthcare, why you got interested in being part of this industry, you are more than welcome to go ahead and answer.
I'll start. So I was struggling as a young person and wanted to get out of the house and, wanted to grow up fast. Now I want to slow down the growing because I'm getting gray hair, but I wanted to find an industry that was that had a lot of options for me. I was a moving, grooving kind of person. And I didn't want to be rich or anything, but I wanted a good living, something where I don't have to struggle, to worry about when I go, can I buy this or can I buy that? I want to be able to have a decent living, but at the same time, options and secure job security. And so not wanting to invest in the years of schooling required for doctors in some of the other fields, I decided to go for nursing because I like taking care of things and taking care of people. And I thought, I'll try it. Scared to death of needles, scared to death of blood, scared to death of poop and all of that. But at the same time, I thought other people can do it. So I could at least try. And if it doesn't work out for me, it's okay. At least I said I tried. So I'm so glad I tried because 23 years later, I'm here. Donna's got a great story.
Yes. My turn. Okay, I'm unmuted. Okay.
You're not muted.
Okay. Anyway, as I finished high school, I belong to a family of mostly nurses. My mom's a nurse. All my aunts are nurses. My sister's a nurse. And now also we're all excited for my niece who's graduating as a nurse this June at Glendale College, Community College. So I graduated at Glendale College for my AA degree and then went and back to school and got my bachelor's in nursing and master's in nursing at WGU School of College. And as a nurse for 26 years, I've been a bedside nurse. So I love taking care of patients, making sure, they're okay. And just being there, to work with them and be their nurse. And so I stayed at the medical center at Cedars-Sinai, taking care of patients at the bedside for 26 years. And then after that, I said, maybe I need to see what other things are out there within the medical center. So I joined in the outpatient clinics of Cedars-Sinai, and I was an assistant nurse manager over there. And then after 6 years, I decided to go to another umbrella of Cedars-Sinai, which is the Cedars-Sinai Care Foundation right now as a manager. But I just want to all of you know that I didn't start as a nurse. When I got into Cedars-Sinai, I was a secretary of our unit, and then I took the boards for the LVN, and then I became a registered nurse where I started from clinical nurse 1 through 4, then assistant nurse manager, and now manager, and planning to be retired soon. So Cedars-Sinai has been really great to me. So I've been at Cedars-Sinai for 33 years, and I'm still loving to be a nurse. So hopefully everyone out there, it's not an easy work, but if you have that compassion and caring and empathy and great communication and also be a great listener, our patient needs all of you. Thank you.
Thank you so much, Donna. That's such a great and wonderful story you shared with us today. We also have Nancy back, so I can hand it over to Nancy for a few minutes if she'd like to say a few words before we continue with the questions, because now we have so many questions in the chat we're going to get through. So Nancy, if you'd like to unmute. I know she was having technical difficulties.
Yes, hi, can you hear me?
Mhm.
Yes, we can hear you.
Hi, my name is Nancy, and I've been a medical assistant with Cedars-Sinai for, it's going to be 20 years in September. And I've been with infectious disease doctors, so I've seen doctors come and go and work with all different kinds of patients.
Thank you so much, Nancy, for participating today and for sharing a little bit about your day-to-day. So we'll go ahead and take on some of the questions in the chat. There is one from Marcela. How many years did it take to become a registered nurse? And
I'm
anyone?
an assistant. I'm not a
Sorry, Nancy. Anyone is welcome to answer that.
I can answer that. So I went to community college at Glendale. So with all the prerequisites, I think it took me 3 years to finish all the prerequisites, and then went to the program for another 2. So a total of 5 years, but that's just with an AA. And then you don't stop there. Then you start taking your bachelor's, and then you don't stop there and then just take your master's. So I got my master's degree at the age of 55.
So let me, if in general, the program is set up 2 years for an, tell us what an AA is, Donna, because I don't know if the teams know what that is.
It's associate, well, it's really AS, Associate of Science degree. So for the community college, so you can still become a registered nurse with an associate degree and take the same NCLEX.
Yeah, so the LVN program is normally around a year. The registered nursing program, if you do the associate degree, you can still have your license and work as a registered nurse, but you have an associate degree. That's 2 very different things. One is a degree and one is a license. The associate degree is around a 2-year program, give or take, depending on what program you're in. And these days, there's lots of flexibility regarding online, so you can do it faster or sooner. Faster or later, depending on your lifestyle and what program you're a part of. But generally it's 2 years. And then a bachelor degree is another 2. So 4 years total for a bachelor. And then once you have your bachelor, another 2 years for master's. Donna took a little bit longer because she took her time and she worked. She has a family, all that. I did my master's in 18 months. Some people do it in 3 years. Some people do it less. And so it just depends on the program, but generally it's set up to be about 2 years ish if you go straight through. Does that answer your question? And
Yes.
another 2 years for doctorate. So after your bachelor, it's 2 years. Every step up is 2 years in regards to your education.
Thank you so much. So we'll go ahead and go to the next question. What are some of the pros and cons of being in this industry? And that's to anyone, to any of the 4 speakers.
Does Nancy or Diana have anything to add from the medical assistant perspective?
Yes. Well, there's a lot of positive more than negative. The only thing is, like, I feel like don't take anything personal. We're here for patients, and there's gonna be all kinds of patients that you have to deal with, but don't take it personal. We're here to care for patients and day by day, and just be I think we have to have also a lot of patience, like the patients, but I feel like there are like all kinds of patients. So what I'm trying to say is, like, don't take it personal. There's a lot of going on with patients. I guess it's day by day thing.
Is
Thank
Diana
you.
on? Diana, do you have anything to add? Maybe she's working with the technology.
Oh, yes, I am. Sorry.
No worries.
Okay, so let's see. I went to medical assisting school many moons ago. I went to Bryman College in downtown. I did my, class for 6 months, and then we did externship for 1 month after that. And back then, you are thrown out, to do your externship. And you have to go there with open, your little notepad and your pen to write down everything that you don't know what you're going to be, exposed to. but you have to go there like with a positive attitude, you know, willing to learn. You have to accept constructive criticism from your mentors, you know, because you want to be a really good medical assistant. You may not be, you know, a nurse, but you do have to follow protocols in, you know, in the office that you're doing your externship. And I feel that with that, and you, if you like, you know, the medical office setting, the back office, because a medical assistant can do front also, you know, back then when I went. So, you know, I started off doing front office work and then worked myself up to working in an internal medicine environment. And then from there, I went into a specialty department, which I was able to work with an oncologist, a dermatologist, an orthopedic office, pediatrics I did. And, you know, so a medical assistant, you can go into different fields to see which one that you feel comfortable with. So the clinical setting is different than a hospital setting. So, you know, you'll have your manager or your supervisor there, you know, to help you get through, you know, whatever procedure you have to do. And it's always good to have that positive attitude, you know, if you're are choosing to go into the you know, to be a medical assistant. The one thing that I do recommend that you go into it for, because you love to help patients, because you are compassionate, because you how would I say, you love helping people. Don't do it so much for the money. Yes, the money will, you know, come with experience, you know, if you learn at the end, you know, you'll probably, you know, be an amazing medical assistant, but do it because you want to do, you know, whatever health career that you choose to, because you're going to be in it for a long time. And yes, we can change careers, but you want to do it because you want to do it. You know, you love it, you like it. You know, patients are going to rely on you to educate them, to guide them, to just you know, you being in the field, you'll know, you know, when you're there, how much patients rely on you for any, you know, for questions. And we as medical assistants cannot give advice or you know, triage or anything like that. But you know, if you have your you know, your RNs on the floor, you know, they will tell you and guide you. And it's a really good career. You know, here in Cedars, I've been a medical assistant for 22 years in dermatology, and I really, really love it. I have wonderful support from my supervisor and my manager, who, you know, really guide in, you know, directing you, you know, so that you can help your team in the back as well. So I really, really encourage, you know, everyone that if you do choose a healthcare field to go into, do it, you know, not so much for the money, though it does reward, but, you know, because you care about people. Okay. Yeah. That's what I can, you know, tell you as an experienced medical assistant. And never take anything personal. Constructive criticism, we all get it every day. And that just makes us a better person and makes us more knowledgeable. That's what I can, you know, say about my experience.
Thank you, Diana, for sharing.
you.
So another question we have is, do you think that being an occupational therapist is a good career? And I know Diana just mentioned that we should do this for other reasons than just the money, even though the money will come along. But this student also wants to know, do occupational therapists make a lot of money? So I don't know to what extent you can add to that, because I know you're registered nurses and medical assistants, but is occupational therapy a good career, in your opinion?
I'll take that one. Occupational therapy, physical therapy, RN, MA, it's all, I'm gonna circle back to the pros and cons. The pros that it's all very rewarding. In a nutshell, it's a rewarding career. You're doing something that helps someone, whether you're front office, back office, you're contributing to someone's health. So if you come from the point of view of building on what Diana just said, if you come from a point of view of this is what you want to do, and this could be my mother, this could be my father, this could be my cousin, this could be my husband, this could be me. How would you want to be treated? If you come from that point of view, you're going to be happy and successful. So, which speaks more loudly than a monetary, award that's coming in. And that, like I said earlier, I didn't go in here to be rich, because as a nurse, you're not going to be rich, but you will have a decent living, and you will have the job security. So occupational health, back to your question, same thing. If you go into it wanting, that's something you want to do because, the nursing thing is just too much blood and guts for you, or this is too much whatever, or this is, something that you've been looking at, do it, because you will have job security, and that's one thing I can say, is you will have job security and you will have a decent living. You won't be rich, but you will have a decent salary that's going to pay, for your daily living and your family, and hopefully, kids in some college later. So, how much money is, it's public info. So you can always Google that. Depending on the state, it fluctuates. So not just state, but the area of the state, the West Coast here, or the West Side here, by Cedars-Sinai, UCLA, the pay is different than the Valley. So if you work at a hospital in the Valley, the salary range for an RN or a medical assistant is different than what's out here on the West Side. So you can always Google that. The information is public for you.
Thank you so much. And this question is for any of the four speakers. What are some challenges or struggles that you faced along your educational career, or as you were learning to become part of this field?
Donna, you want to take that one?
So for my educational career, so I started my bachelor's at a later age. I was older already. I got my daughter graduated from college. So going back to school after, I think it was 20 years. So it was really a struggle for me to start, the books and homework and all that again. But, I had lots of mentors and my family supported me. So I got through it. And then later on, because as you want to grow and, be in a ladder higher than, just being a bedside nurse, and you want to join the leadership, then you have to take, additional degree so that you can, learn more. And nursing is a learning process every day. I learn every day. You don't stop learning just because you're working and be a registered already, but even with my patients, I learned so much from them. And then also, as I wanted to be and see, I just wanted to experience to be a manager, I needed a master's degree. So I went another degree, and with the help of Cohen, who just who believed in me that I can do it. I graduated during the pandemic. And that was one of my biggest accomplishments, and I still do miss being a bedside nurse up to this day, and right now, I don't have any patient, contact, but working with staff is another thing that I enjoy also. So there's a lot of paths that you can go through as a nurse. Okay, it doesn't stop at the bedside, but there's so much openings there that you can go through.
Thank you so much. And someone else asked, would you say being in the medical field, does that still give you enough time for yourself, even though you have a career in such a stressful field? Would you still have time for traveling or building your family, kind of like a work-life balance?
Nancy, are you available to answer that?
Yes. Yes, there is time. There's time for everything. I feel like I have 3 kids. I'm married. I still travel. I love traveling and going road trips and everything. I still have time for that. Yes, there's definitely time for that. And then you enjoy, your little breaks, and then come back to work and share with your coworkers, sometimes with patients. And yes, there is time. There's time for everything.
Thank you, Nancy. Next question is, what is something you wish someone told you before you chose your career?
That's a great question. Who asked that question? Diana, you want to take that? She's laughing.
Let's see. It's really hard. Well, in my situation, I am the eldest of the family. So my father wanted me to start going to school right after high school, and I didn't know what I wanted to do. So I went to a counselor. I went to East LA College. Asked counselor, I don't know what to do. Can you guide me? And from there, I wasn't. After meeting with the counselor, they give you options, and medical, or you wanted fashion design, or so. I think I would advise you to start with a counselor at the college and see, what your interests are, and maybe guide you, there. Because coming out of high school, you really just don't know what you want to do. There's so many things that come to mind, but what do you really want to do? What is going to make you happy in your job, to continue studying, to focus, and, just thrive and do the best that you can. So my advice, talk to a counselor, and you take it from there.
Thank you so much, Diana. And we'll do one last question before moving forward to our next presenter. So how do you stay informed about advancements in the medical field?
I'll take that one. I stay informed where we participate in different organizations. So for example, my past career path was transplant. So I got certified in transplant, and I get regular notices from them. And I still am. I'm certified. I kept my certification. So I stay on top of the transplant platform, with all of the news that come through. They have conferences every year, which I still participate in. As an ambulatory nurse and a leader in ambulatory now, I'm part of Becker's and nurse executive or nurse leadership organizations where they send me notices every day. So I get, if something new happened, like the Redondo Vault big criminal case that happened last year, I got notice on a regular basis on what's happening each court date, a new, medication. Currently, there's the Candida auris, outbreak that's happening through our country. Usually it doesn't happen in the United States, but it's rampant right now. And so I get notice every day. Now California's affected. Now Tennessee, there's up to 10%, whatever. So that's how we stay abreast through our membership organizations, whether it's ambulatory nursing, ortho nursing, Donna's part of the message nursing. And that's how and then we disseminate that information to all our teams. I would disseminate that to Diana, Nancy, all their teams. And they share with me if they know something, there's a recall on certain equipment, they will forward that to me, or I will forward it to them. That's how we pass information along.
Thank you. Thank you for answering that question. This concludes the Q&A portion. I'll go ahead and hand it over to Jose before we introduce our next presenter about an internship program. I know a couple of you asked questions about how do you know what field within the healthcare industry to focus on, or how do you get exposure? So that is a great question for Jeanette, who will introduce the program. But before that, Jose has a few words.
Yeah, I just wanted to circle back to the speakers and the amazing stories that you guys have, Donna, specifically as well. Showcases there is no age limit in going back to school. So for the students that are not sure if they want to pursue school right now, there's always time. So I want to applaud Donna and the team for having the opportunity to discuss. And I actually would like to go through each speaker and maybe just 30 seconds to allow Jeanette enough time to kind of speak and provide the great resources that she is going to. But 30 seconds from each speaker. One last thing to advise the students. What would you inform the students? Any advice that you would give these students who are thinking about going into the healthcare? And I actually would want to start with Donna. So really brief.
My advice for you is, if you want to go into healthcare, you can volunteer first and see if you want to work at a hospital or outpatient clinics, and if you just love helping people, as I think Diana was saying, or Nancy, go for it. Any dream that you have, just keep trying, but don't give up, because education is our number one thing that no one can take away from us. So that's my advice. Just go out there and see what you can explore. And there's no time, whether you're young, you're old, go to school.
Thank you, Donna. Appreciate that advice. I actually would take one more last comment. I know we said 4, but one more. I would actually want to hear from one of the medical assistants, whether it be Nancy or Diana.
I just have to say, never give up. Never, ever give up. You're going to have struggles that are going to make you want to quit, but don't let that stop you from moving up in the future. Just never give up. You will have struggles, and just keep pushing yourself up to your dream or to whatever you're aiming for.
Thank you so much, Nancy. Again, it's greatly appreciated your feedback and the opportunity you guys took out of your time to speak to these students. And I actually want to now pass it out to Ms. Gonzalez, who has the floor.
Hello, everybody. It's so good to be here. You guys have all shared such great background and stories about your own personal life. And I just feel privileged to be here to share amongst all of you. So many great questions. My goodness, the questions are coming in and I was just like, whoa, wasn't expecting that. So I think you guys are ready to just kind of get out there in the real world and check things out. So without any further ado, I will bring my presentation up. I am here to talk about where I work at and what I do basically and what our program is all about. So my name is Jeanette Gonzalez, and I'm going to share my screen. Can you guys see it yet? Yes. Okay, awesome. So the name of the program that I oversee is called the CCALAC AmeriCorps Health Fellows Program.
And our program has been around for about 9 to 10 years now. So it's been a little while. And just a little bit about myself. Again, I'm Janet Gonzalez, and I'm the AmeriCorps Program Manager. I was born and raised in Hartford, Connecticut. I obtained my Bachelor's of Science at Springfield College in Springfield, Massachusetts. So I am an East Coast girl, if you can't tell by my little bit of an accent that I have. And I am Puerto Rican, and I am a very proud Puerto Rican. So my parents were both born in Puerto Rico, and so Puerto Rican culture is just, it's in the blood. So I've worked in the community health for about 7 years now. I have been at CCALAC for 4 years now, going on 5 years this year, which is crazy to even think about. And I've worked with youth and young adults approximately about 25 years. So it's been some time. So CCALAC stands for Community Clinic Association of Los Angeles County. And just a little quick snippet of our history. We were founded in 1996. We have 64 member clinics and over 300 clinical service delivery sites. And we serve 1.4 million patients annually, which is a huge number. Our mission is to promote free and community clinics as providers and advocates for expanding access to quality comprehensive healthcare for medically underserved people in the Los Angeles County. CCALAC has numerous pipeline programs. So we have, right now we have 5 pipeline programs that we are working with. We have the AHEC Scholars Program, which typically caters to people that have their master's degree. We have the Allied Health Internship Program, and that is for people that have their medical assistant certification or whatever that is. I think it's either a certificate or a degree, sorry. And the Nurse Practitioner Residency Program is for licensed FNPs, and I think it's LVNs. Along those lines. And then we also have the collaborative for retention, engagement, and wellness, which we call CREW. And that really caters to the human resources, leaderships, and those that are in managerial positions. And then there is the program that I oversee, which is the AmeriCorps Health Fellows Program. And we've always catered to people that have just recently graduated from college, but we have opened it up this year to people that are graduating from high school as well. So I am so excited that you guys are here and checking out the internship program. So thank you so much, Jose and Mariana, for having us share a little bit today. So a little bit of history about the AmeriCorps program. It is the national service program that engages over 80,000 Americans in intensive service each year at over 21,600 unique sites, including nonprofits, schools, clinics, and faith-based groups across the country. AmeriCorps service is in the areas such as education, health, disaster services, economic opportunity, and the environment. And we primarily focus at CCALAC, our program, focus specifically on community health and providing access to primary care and health services to under-resourced communities in Los Angeles. So just to kind of give you a synopsis of what the AmeriCorps Health Fellows do, or what they will encounter when they are there, or rather how the program is run, some of the benefits that you have. So we focus on increasing access to comprehensive primary care within the LA County, which is what I've already spoke about. And this is really for people that just really need resources. They are in search of resources, they need these resources, and we have what they need. So we're in partnership with California Volunteers and the Corporation of National and Community Service, which we call CNCS. They are our grantors. We select the AmeriCorps Health Fellows and we place you in one of our member clinics. So you would be there full-time working for 10 to 11 months. So you'd be typically doing about 40 hours a week while you're working there. And it's a great experience, but I'll go into a little more. So it varies the roles that you're in. We have you do outreach, enrollment, health education, amongst a couple of others. The AmeriCorps Health Fellow receives $25,500 living allowance. So that's dispersed every 2 weeks. You would get a paycheck that at the end, it accumulates to $25,500. You're offered health insurance if you are a full-timer. You get student loan forbearance. So if you were someone that had student loans, you would get student loan forbearance during that time that you are in the program. You get mileage reimbursement. So if you're traveling from clinic to clinic, you get reimbursed for that. We offer you trainings. And then we also have a $10,000 education award. It's 2 different awards, but the total is $10,000. And you get that once you have completed the program successfully. Most of the fellows have the opportunity to get hired at the clinics, which is absolutely amazing. You know, you get the experience there for the 10 to 11 months while you're there. And then at the end, having the opportunity to get hired is just mind blowing. I went to Eisner Health Clinic last week, and 7 of my previous health fellows came out to greet me and say hello. And it was just amazing because 7 of them got hired there full time. And so it just goes to see, you know, to show how the clinics really love the AmeriCorps Health Fellows, number 1. And number 2, they end up getting hired there and they love the experience that they have. Our recruitment has already started. So our application process is already open. This is the link here, which we can also provide to you as well. For the AmeriCorps Health Fellows program. So again, with the positions that you have, the duties of an AmeriCorps Health Fellow is providing health education. So the health education piece is basically talking and sharing with your patients about diabetes, asthma, hypertension, and then there's one more. Diabetes, hypertension, asthma, and gosh, I can't think off the top of my head. So you're just providing them the education, just helping them curve the health concerns that are there. Then there's enrollment into the health insurance that is out there that's free for them. Most times people don't know that they have free access to all of this stuff. So enrolling them into health insurance, sometimes the clinics have different types of programs that they can get enrolled in as well that would benefit them. And then we also have case management. So they are managing cases on the regular basis, making sure that your patients are having all the care that they need and the resources that they need. And then outreach is one of the last positions that, one of the positions that the health fellows do. So that is basically picking up the phone, calling our patients, getting them into the clinics. Most times our patients are struggling to get into the clinics. And so you're there to help encourage them come in so that they can take care of the health issues that they have. Training is provided for all of our health fellows. So sometimes I think people see some of these positions and they think like, oh my God, how am I gonna do that? I don't know anything about diabetes and I don't know anything about asthma. But we always provide the clinics. They provide the trainings that you need in order to do your job efficiently and effectively. Then we have some pictures here to just kind of show you what are some of the things that we do. The outreach, as far as outreach is concerned, sometimes you are going out doing health fairs within the community, doing food drives, things of that nature. And so here's some of the things that we do. We also have what's called service days. And so like on Martin Luther King Day, most of the clinics close, but AmeriCorps is out in the streets going to Skid Row and providing them hygiene care kits or providing food or helping at some sort of food bank. And so we're usually out working on MLK Day and giving back to the community. And so these are just some of the pictures of some of our previous fellows. COVID-19 hit us pretty hard. It has been very difficult for a lot of people, but even though COVID came, we were still out there. We were packaging a lot of the products that came in. We were delivering masks and COVID-19 kits to help a lot of our patients get access to that. Gloves, all of the things, we were giving all of this out to a lot of our clinics and making sure that they had all that they needed. Things were getting shipped in. We actually had a storage unit to make sure that we were able to have all of the products to have it delivered.
Thank you, Jeanette. Just so you know, some of the students are logging off because their
Oh,
period
they gotta go
has
to class.
ended.
Yeah.
Yes,
Okay.
yes. So sorry to cut you short, but we can share the slide deck with them
Yeah.
and their teachers to circulate the link as well, so they have access to that.
Yeah.
But sorry to cut you short.
No worries, no worries at all. No worries at all. But yes, if you guys have any questions, please feel free to reach out to me. The link will get straight to me, and my email address. Actually, I'll put it here on the bottom in the back here. Oopsie, maybe not. Here's my email address. So if you guys want to reach out, please feel free to do so. All right, it's jgonzalez@ccalac.org. Thank you guys so much for having me.
Thank you, Jeanette.
Yes,
Thank you
yes.
so much. And thank you to the speakers, Quinn, Diana, Nancy, Donna. Thank you so much for spending the time today to speak to the students. We look forward to the follow-up conversations as well. So thank you, everyone. And thank you to all the students who joined. I know you guys are
Yes.
running out.
Thank you.
Thank you, everybody.
Bye.
Thank you.
Bye.
Thank you.
Bye.
Thank you.
Thank
Bye-bye.
you, Juan.
Mr. Russo, do we have like their emails that maybe we